Psychedelic Medicine Association is the world's only organization aimed at educating clinicians from across the field of medicine on psychedelic therapies and how they may impact your patients and your practice. We have 1,000 members from the physician, PA, NP, therapist, counseling, and social work worlds who've come together to learn about these impactful new options. We also have close to 100 member organizations, including clinics, research organizations, law firms, educational platforms, and drug development companies that have joined to both help educate clinicians and, importantly, to learn from you on how to best serve patients. For more information about our upcoming course or about joining the Psychedelic Medicine Association, either as a clinician yourself or as your clinic or business, you can find us at psychedelicmedicineassociation.org. We would love to have you join us in our mission. There are incredibly effective new psychedelic therapies coming that can offer a lot of hope, both for our patients and ourselves. Join us today.
What do psychedelics do? Psychedelics, at their kind of most simplistic mechanism from a very high level, they kind of relax these overarching predictions. So all of that past experience the brain is making to make these predictions about the world, about who you are and your internal state as well, that kind of gets relaxed. And when that gets relaxed, it allows the bottom up, the sensory input to kind of flow in, and you're more open to receiving these things. But really you're in a state where your brain is less predictive and it's willing to now alter its past predictions based on more incoming sensory stimuli, whether it's from the external world or from your internal state.
The fact that psychedelics have such a potent anti-inflammatory response throughout the body, but especially in the brain where these receptors are most concentrated, is extremely promising for controlling that out of control inflammation that occurs following chronic stress or following traumatic brain injury. It's also seen in post-traumatic stress. So the fact that these substances can hopefully mitigate some of that is very, very promising.
Organizing the Ibogaine conference in 2009, I was exposed to Ibogaine as one of these addiction interrupting treatments, these very complex, pharmacologically messy substance that has activity on all sorts of receptor networks that, in addition to attenuating opioid detoxification withdrawal symptoms, also activates growth factors and had potential to repair damaged brain cells that you would often see from methamphetamine addiction, things like that.
The thing that I like about psychedelic research right now is we're focusing on singular compounds. So we're focusing on psilocybin, which is a tryptamine serotonergic psychedelic. It's a singular compound. LSD, which is an ergot alkaloid, singular compound. And I think that as we move forward, that's kind of next level questions. Like, okay, like, is there a difference between if we can prove that phantom limb pain is alleviated by psilocybin? The next question is it different if we give them an actual mushroom or a synthesized psilocybin? Is there added benefit to eating the whole mushroom, or can you just extract psilocybin?